If you or someone you know is struggling with anxiety or depression, hopefully you know that you certainly are not alone, and chances are you might be a little bit concerned as we approach into this holiday season, because these next several weeks can be fraught with difficulty, emotional ups and downs for people who are already struggling. So it's a great time for us to have Charles Miller back on the show. He has Scenic City Neurotherapy. Good to see you.
Thank you for having me.
I guess kind of, you know how they do the word of the year every year? Maybe a word of the year might become prevention. It seems like everybody in every field is looking at a way to stop it before it starts.
Right. Proactive care seems to be the secret to keeping everyone healthier, happier, longer. One of the things that we're big on is making sure that we stay ahead of our issues rather than once we're behind playing catch up. We have therapies for both, but the best way to prevent a problem is for it to never allow it to come into play.
Okay, so I mean, you and I have talked every month for a long time now, Charles, and I worry that I might repeat myself often. But do you have any just own theories of your own when you and your wife are at home at the end of the day about why we do seem to have so much more anxiety and depression out there now? Is it awareness, or is it really a rise?
I think it is a lot of awareness. You know, our world around us is very loud, and everything is always driving us towards stress. Stress keeps us anxious, it keeps us focused, it keeps us buying, it keeps us, you know, and so a lot of advertising or a lot of products push fear or stress. And so we see a lot more of that in our world just day to day.
So you walk hand in hand, of course you do, with mental health providers. When someone comes to you at Scenic City, then they're going to get the treatments with you, but then you want the conversations to continue with a mental health provider. Right.
You know, when you're seeing a psychiatrist, they're prescribing medications. When you're seeing a psychotherapist, you're doing a talk therapy component, different types of therapies to try and deal with underlying psychological issues. What we do deals with the physiology of the brain. We do this treatment for many different disorders. We do it for everything from anxiety, depression. We treat also, Alzheimer's, dementia, stroke recovery, traumatic brain injuries. It's about rebuilding the brain and keeping the physiology or the actual wiring in the brain functioning optimally and healthy.
Let's go back a couple of steps then for those who might not have seen you and they don't know what these treatments are. Generally what you're doing is ketamine, right?
We do ketamine infusion therapy. We do transcranial magnetic stimulation. Those are our two primary therapies.
Okay.
But both have a similar mechanism. They both stimulate the brain to regrow connections to where the patient doesn't feel good or bad. They feel their world in a more correct way, meaning that when the good things happen, they get to feel good. When bad things happen, they'll still feel bad. You know, if something that's anxiety provoking occurs, you should feel a certain amount of anxiety. That is the correct way to feel when something that should produce anxiety happens. But you should feel the right amount, not an excessive amount, and that's where the problem lies.
Okay, so I'm going to try to baby step my way back to what you wanted to begin talking about, which was this desire to kind of be a proactive approach for people.
Yeah.
So is it kind of like early intervention at the first signs of something becoming untenable?
It can be. It can prevent something from setting up. You know, after a period of heightened stress or a traumatic event, we can actually treat the patient and address that to prevent a long-term mood disorder from being created. We can also help patients who have been on medications for years and years and years and haven't seen the results they want because the medications, they are designed to minimize our emotions. They minimize how we feel, but they take away a lot of the bad, but they can take away a lot of the good too.
2 minutes left. What about the genetic component? I mean, so often bipolar, for example, runs in families. So if you have a teenager who's newly diagnosed, should you be a conversation stop?
It is something that needs to be addressed, depending on age, depending on environment. We need to start looking at, rather than trying to over control the brain, try to improve the health of the brain, try to improve the health of the environment. Building of healthy outlets, coping mechanisms, that happens with the psychotherapy component of what we do. And there is a scenario to where medications can work with what we do as well, the daily medications. But with ketamine infusion therapies and transcranial magnetic stimulation, what we do is a rapid correction of a deficit that exists that's actually creating the mood disorder. And so when we treat that disease at the core, the symptoms like what we see with bipolar, what we see with depression and anxiety, they stop manifesting.
So with the minute I have left, if people call your office and they want to learn more, does it first begin with the consultation? What does that initial visit look like?
You'll call in, you'll schedule a 1-hour consultation, you'll sit down with myself or one of my other providers at our office, and we will talk about your condition, what we're trying to treat, if this is something that is even a good direction for you. If we determine that it is, we show you what a plan looks like. You kind of, when you leave that first day after a consultation, you kind of know what the program's going to look like, you know what it's going to cost, you know what the whole, if insurance is going to cover what you're doing. There's so many components, but the best way to get those answers is to come in and talk. It costs nothing to sit down with us.
Right. Okay, so here's the number for you to call. It's Scenic City Neurotherapy, 228-0579. They're on Shallowford Road, and as you heard him say, I'm the one who mentioned the depression and anxiety. But if you are stroke recovery, PTSD, anything, Alzheimer's, he can help you. I would love to try. Thank you.